Hey folks, Doug Blake with Body Design University. In this video, I want to talk to you about a very common issue that I've always had with clients. Not every client, but in general, and you can probably agree with this, issues related to pain or discomfort in the neck. So think about it. Have you ever, either you yourself or while you're training somebody, you ever do like an exercise like a lateral raise or dumbbell presses or shoulder presses, and God forbid, behind the neck, don't do anything behind the neck, pull downs, do everything to the front, meaning shoulder presses to the front, lateral lat pull downs to the front, or pull-ups, things like that. But you ever get discomfort, not just in the trapezius area, but all the way up into like the cervical spine area? And I've had this over and over again. And keep in mind, one of the most important things that you can do as a trainer is deal with the most common issues that occur when people start training, particularly inexperienced trainers. It's going to be dealing with pain and discomfort, and you got to know some what are called workarounds. So in this video, that's what I want to talk to you about, is how you deal with particular issues related to the neck. In other words, neck discomfort. But before I do that, let me ask you a question. Are you subscribed to this channel? If not, we would greatly appreciate if you did that, because if the content is helping you, then for sure you want to be receiving notifications all the time when the new content comes out. So if you find this video or any of the other videos that we have put out on YouTube and Facebook, please go ahead and subscribe and let us know. Give us a comment. Let us know that the materials are benefiting you. Thanks. Now, back to the subject at hand, which is neck discomfort, particularly when you're doing shoulder exercises. Now, don't get me wrong. You'll get neck discomfort from doing just about anything. I mean, depending on how bad your posture, how bad your biomechanics are, not only while you're doing the exercises, but just the inherent nature of the neuromusculoskeletal system, right? So those are the things that you have to take into account. But here's two things to consider when you're training. Let's keep it simple. Let's talk about shoulder training, right? Delt training, i.e. shoulder presses, dumbbell presses, or even lateral raises. And I will say this, lateral raises can be some of the worst on clients' necks. Now, I know that if I'm doing it and I'm training, I've got to be really, really careful. And the two things that you want to kind of keep in mind is, first, is the elevation of the shoulder girdle, right? Or the scapulae. Now, remember, the scapula are just the bones. So when we talk about scapular movement and kinesiological function, that's one thing. But we're talking about the entire complex, or the shoulder girdle, which includes not only the scapula or the backbones, but also their connection to the glenohumeral joint. In other words, the shoulder joint. So you've got the scapula, and my thumb kind of represents the glenoid fossa of the scapula, which is where the humerus, the head of the humerus, sits in. That's called the glenohumeral joint. So together, when you lift your shoulders up like this, that's the entire shoulder girdle. Shoulder joint, glenohumeral joint. The shoulder girdle is the entirety of all the joint, or what we call articulations, related to that movement. So that's the first thing. First and foremost, when you're training shoulder presses, for instance, or you're doing lateral raises, what you're going to notice is that due to glenohumeral rhythm, this normal pattern of everything trying to help and assist when you do the movement, because of that, the tendency, especially for your client, is going to be to elevate or lift the shoulder girdle. One of the best things to do for that is to tell your client to lift up their rib cage. If they lift up their rib cage, right, generally the shoulders will retract slightly and depress. You can do it yourself. Just sit there like this, and I'll step back a little, push back a little bit. And what you'll notice is if I collapse my rib cage, it's so much easier to shrug my shoulders. But as soon as, if I lift up my rib cage, you see how that automatically, I'm not really even trying, But if I lift up my rib cage, right, I lift up and I create that lordotic curve in my lower back, it almost forces the shoulder girdle back and down. And that's key. That's number one. Look for the elevation of the shoulder girdle and simply respond or give the cue that they should lift their rib cage up. Now, that's going to help a lot of different exercises, by the way, but that's the one thing that I will always tell my clients, go ahead and lift your rib cage up, especially if they start doing stuff like this. And I can see them kind of feeling that, yeah, I feel it up in, okay, well, here's what we're going to do. Next time, what I want you to do is when you're doing your presses or lateral raises, let's go ahead and keep that rib cage, lift the rib cage up, and that should allow for a little bit better biomechanics of the shoulder girdle, i.e. retraction and depression of the scapula. Okay, so that's number one. The second is, you probably already figured it out, it's the head position. Because I'm going to tell you, that is the one area, that's the second thing, that is the one area that can really cause neck discomfort, particularly in and up the cervical spinal column. Okay, all of those cervical muscles in the back. Now, remember, discomfort in the neck could come from, one or both these two areas. The trapezius or the upper trapezius, right, gets fatigued, and or those muscles in the cervical spine back here, right? So these extensors of the cervical spine, and they will get fatigued. Remember, shoulder elevation, shoulder girdle elevation, but then there's also the positioning of the cervical spine. So if clients have their heads too far forward or they have them too far back, it could cause a lot of fatigue and discomfort. So first is get your client to lift up the rib cage, pull the shoulder girdle back and down. The second thing is that when they have poor positioning of the head, is to make sure, I tell them, get the chin up and look in a sort of forward down, just forward and down, especially if I'm doing lateral raises. If I'm doing lateral raises, I don't want them doing this. I also don't want them doing this, obviously. Okay, so you want them you could use the word neutral. That's fine. I usually will cue clients and say, look straight ahead and down slightly. Straight ahead so they don't go too far up this way. Straight ahead and down slightly so that the chin is in a more comfortable neutral position without tucking the chin down this way, right? So those are the two primary things that I will always tell clients: keep the rib cage up. And by the way, when you tell them to keep their rib cage up, it's really hard to keep the chin down. So they lift their rib cage up and they get their head into a much more neutral position where they're looking straight ahead, slightly down. Of course, obviously, we don't want any lateral deviation of the head while they're doing the exercise as well. Now, you'll know that that's a problem because they'll have unilateral discomfort. In other words, one side will be uncomfortable. So if they're doing, I've seen it 1,000 times, right? People will lift up and they'll do something like this. And it is really, really subtle, very subtle. You won't even see it. You got to kind of look at them, look at it from the back, from the front, and you'll be like, okay, keep your head in a upright position. Those are the two main things. There are some other issues that a client may have, but those are your two key components to ensuring that discomfort in the neck is mitigated or eliminated when individuals and clients are doing shoulder movement. Again, if you find this information useful, interesting, and more important, if you understood what I just explained to you, it might make a lot of sense to you, or maybe it just kind of triggered something that could help you. Write the word understand in the comment section below. And of course, yes, please subscribe and hit the notification bell as well if you found this information helpful. Also, if you want to become a certified and qualified personal fitness trainer, go ahead and click on the link in the discussion box, and you can go ahead and get signed up at Body Design University. Also, keep in mind that for those of you that are already students, we would love to have you every Wednesday night participating in our Quizlet Live. You use Quizlet, it's a great study tool. Do Quizlet Live, it becomes a competition, and it becomes a lot of fun. 6 p.m. Eastern Standard Time, 6 p.m. Eastern Time, 5 Central, 4 Mountain, 3 Pacific. I say that so many times now, it's easy. 543. Okay. 6 p.m. to 6:30, 30 minutes. It's a lot of fun. It's very helpful from a studying perspective. If you have any questions, you be sure to let us know. Write it in the comment section. Have a great week. We'll see you next week.